HIV, and onto your show, let's talk about health. About 2 weeks ago, we met the last time, and the program was on cancer. We had an overview into cancer, and I must say that the feedback I had from this show was incredible. Tonight promises to be a very interesting one as well, and I can't wait to get started. But before I do, I want to say thank you to Omega House Multimedia for giving us the platform to have all these health professionals come your way to give us views on diseases, conditions, how to manage ourselves through illness. So tonight, I have a special guest. I always say they are special because they are really amazing people. And I'll give her the opportunity to introduce herself. But before we do, this is just a little bit of feedback from the cancer program. And I take this opportunity to say thank you to Mrs. Judith Asmakujo, who was my resource person that day. The feedback I got, which was very interesting, is that I had two people who shared intimate, gave very intimate views on the disease, and eventually opened up to tell me that they had been diagnosed with cancer. That was a shock to me myself because I wasn't expecting them. But the message they want to go out there is, please talk to people when you are going through difficult situations. They found it very helpful, and through the program, they found the need to confide in me and to share their disease process with me. And that was at least another listening ear. So thank you. I'm not going to mention names, but I am absolutely thrilled that you opened up to share your experiences with the disease with me. I'm sure I'll get the opportunity to share it with other people, but thank you. And thank you to Mrs. Asmakujo for kindly coming to talk to us that day about cancer. Tonight is a big one as well, HIV infection. And I'll let my resource person introduce herself. But just so you know, she's the first person who is not affiliated to Takrady at all. All my guests so far have been friends, colleagues that have come on the show because I knew them from Takrady. So I am absolutely pleased that you are here. Thanks for coming. So can you tell us your name, please, and what you've been doing so far?
My name is Comfort Osmani, and I specialize in HIV. Years ago. So I've been working in HIV for the past more than 25 years.
Oh, wow.
HIV infection and sexual health issues, sexual and reproductive health. It's my passion to support and help people.
That is a good passion. It's a good passion to have. Back in the day, about 20 years ago, if I can remember, I used to work in a hospital back home. And that was the beginning of the outbreak of the disease. And I could easily tell then if somebody had the disease or not. But I've lost touch now because I've not been involved in anything to do with HIV infection at all. So I'm really looking forward to this one. So did you train? Where did you train?
So I trained at the Nurses Training College at the Kolebu Teaching Hospital.
Yeah. If you don't know where Kolebu is, for my viewers who are watching all over the world, from wherever,
Accra, Ghana.
Just Google it.
Kolebu Teaching Hospital in Accra, Ghana.
Accra, Ghana.
That's where I did my training.
Wonderful.
Went on to do midwifery, did public health nursing, and then specialized in sexual health and reproductive and sexual health and HIV, and that's what I've been doing.
Beautiful. And is that what you are doing in the UK as well?
Yeah.
Okay, you continued. I worked a bit with Planned Parenthood Association of Ghana,
I did as well,
and I used to go around the secondary schools teaching the students about HIV and stuff like that.
I was involved
but
too.
I'm rusty, so I'm really looking forward to this.
Okay.
So let's get the ball rolling. What is HIV infection?
Right. So HIV is the human immunodeficiency virus, and this virus was identified in the 80s, and it's been with us for over 30 years now.
Okay.
And for the past 30 years, every year, 1st December, is World AIDS Day. So it's celebrated worldwide, and we have the UN AIDS giving us information and statistics as to what's going on. So the HIV is a virus. It's an infectious agent that uses a living cell to replicate itself and to produce more of itself to infect more of the human being.
You probably have to break it down a little bit with that one. What exactly does that mean?
So HIV, so that would take me into the life cycle of the virus, if you want me to do that now.
Yeah, probably, I think we'll set the scene. You said World Health Organization always has December, 1st of December, is it?
Yeah.
As HIV
World AIDS Day. Yeah.
Okay.
So every 1st December is World AIDS Day. So UNAIDS would bring out statistics as to what's happening worldwide. So just past this December, the information given us is that 37.9 million people are living with HIV worldwide.
Oh dear, that's a lot of people.
Yeah, and 1.7 million people became newly infected by the end of 2018.
Wow.
And we have about 770,000 people who have died from AIDS-related illnesses. And we have 74.9 million people who became infected with HIV, looking from the beginning of the epidemic in the early 80s to now.
Okay.
So, and we have 32 million people who have died from AIDS-related illnesses since the start of the epidemic. So 2018 alone, we had 1.7 million, 770 people who died. But since the beginning of the epidemic, we've had over 32 million people who've died.
Wow, that's an incredibly
So it is still with us, and we need a lot more needs to be done, especially in our communities.
Yeah, and by our communities, you mean African communities?
Caribbean communities.
Wow. If you are not tuned in yet, and if you haven't connected with your friends and family, I will suggest you do that, because you will be surprised at the information that is coming up, and it will be a good idea to share with your family and friends. So we are live now on Facebook and on YouTube. So please do tune in and share with your friends so they don't miss out on this all-important subject. So that is the global statistics.
Yeah.
Oh, so can you tell us how does the virus infect the human being and get us to the stage?
Okay, so before the virus can infect a human being, there will have to be an opportunity for it to do that. And we have genital tract infections, which facilitate the transmission of HIV.
Okay.
So I'll just go briefly into genital tract infections.
Yeah.
So when we talk about genital tract infections, they are infections that are found in the genital areas, the penis, the vaginal and vulval areas, and in some people in their anal areas. For those who have anal sex, it can be found there as well. And these infections can come in the form of discharges. So you could find an abnormal discharge from the vagina, and you realize, though, this is not the normal discharge I usually have, and therefore you become alarmed. So the discharges could be, the color will be different from what should normally be there. So if you see any abnormal discharge from the vagina, and you know that you are sexually active, and you need to go and have a checkup. And sometimes the discharges can come, what people normally call white, the fungal, which is the fungal infection. And it is really itchy. And the interesting thing about the fungal infection is that it's itchy, and when scratching, sometimes it's very nice when scratching it. So you keep scratching, and by so doing, you create minute sores around the vaginal area and the vulval area.
So that is for the women, isn't it?
For the women. Now, when it comes to men, they may experience abnormal discharge from the penis.
Okay.
So if you experience any discharge from the penis, and you know you are sexually active, go and have a checkup.
Yeah.
For those who have sex in their anus, they could also have discharges. Normally, we shouldn't. So if for some reason you have discharge and you know you are sexually active anally, go and have a checkup.
Yeah.
So apart from discharges, genital tract infections can also come in the form of sores or ulcers. And these ulcers, it could be anything. It could be from, I'm not going to mention the medical names to confuse people, but
Yeah.
any form of sore which is, you know, you were not expecting.
Yeah, I mean, normally we don't have any sores there, isn't it?
Exactly. So when you see any sores around your genital areas and you are sexually active, go and have a checkup. It could be a sexually transmitted infection.
Yeah.
If you look, it's something like white. It's not a sexually transmitted infection, which usually occurs with women. It's not. But you scratch and you create sores there.
Right.
And if you have sex with someone who is who has HIV, that is how you are likely to get
the
HIV because
infection.
of the minute sores. So it comes in discharges from men, from women, genital sores.
Yeah.
It can also come in the form of growths. So you see a little swelling, which are usually, we call them genital warts.
Warts,
They are all sexually transmitted infections. And we have evidence to show that these infections will help you get HIV. And therefore, if you have any of these infections, check them out. Avoid sex and check them out. So when someone, for some reason, have acquired HIV, either from blood, either from semen from a man's penis, either from vaginal fluid from a woman, or from the anal secretions from the anal area, or from breast milk.
Right.
That is how, if these fluids are infected, that is how HIV gets into your system.
Wow. Right. So the key thing is the person must have been infected.
The person must be infected. The key word is infected person. So infected blood, infected semen, infected vaginal fluid, infected breast milk, infected anal fluids.
Yeah.
So the key thing is infection.
Infection. What this means is that there are other fluids that are probably not infectious, isn't it?
So current research tells us that HIV is found in all body fluids. But the most effective way of acquiring HIV is these fluids I have mentioned. Infected blood, infected semen, infected vaginal fluid, infected breast milk, and infected secretions from the anus. These are the most effective way of it, because the anus, most often there's blood involved, and that's how people get infected.
So what about saliva, sweat, stuff like,
you don't, it's very, you will not get it from saliva, and you don't get HIV from sweat, from tears, from saliva. You don't. It's very remote.
Right.
Yeah.
Okay.
Yeah.
So you don't have to worry if you are shaking.
You can shake hands with the person, you can hug the person, you can eat from the same bowl and place with the person, you can sleep on the same bed with the person. You know, mosquitoes do not spread HIV because the virus
who live in
Africa because the virus prefers to live in a human cell, in a living cell, and mosquitoes are not human. So we should not be afraid. If you know someone who has HIV, we should not be afraid to interact with them.
Yeah, that's the problem, isn't
it?
And
that's a big problem.
A big problem, because obviously no one wants to get any infection.
Exactly.
It is very important we set the record straight here, because you said about like discharges from places, but normal body fluids do exist, isn't it? But the difference is when it is not infected, it usually seems normal to the person.
Yes.
Yeah, like normal vaginal flora, we know how it's like. So it's key for people to know the normal from the abnormal, isn't it?
Yeah.
So it's any mucousy looking kind of secretion that doesn't come. Normally we don't pass any yellowy discharge or any offensive.
It depends. If someone hasn't drank enough water, for instance, their urine can be yellowish and dark, and that means that if they are going to, they could even see it in their panties, so it could sort of affect in the course of passing urine, they could find a bit in their panties and so on, mixed with their vaginal discharge, because women have vaginal discharge, which occasionally comes out. So it depends. But if you know that you are sexually active and you've seen this yellowish or brownish looking discharge, it's not, you are not in your menses, you are not menstruating, and you find these discharges and they are offensive, they smell, and it's not the usual color you should always see, or you have some abdominal pain going with it, go and have a checkup, especially if you are sexually active. Go and have a checkup. It could be gonorrhea, it could be nothing. But you want to go and have a checkup. The earlier you are treated for it, the better.
The better for you.
Yeah.
Now, this brings us to how HIV actually gets into the body, isn't it?
Yeah, so that brings us to the life cycle of the HIV.
Right.
So the HIV has a life cycle.
Okay.
So what it does is that if for some reason a person is infected through any of these fluids we've mentioned, so HIV gets into the body. Now, I will describe the body as a nation. A nation has a security personnel, and the security personnel are in groups. We have military, we have police, we have other securities, small security agencies. They all play a role in protecting the citizens and also protecting the country. Our body is like a nation. So when it's also got security systems in place, and there's one particular security system called CD4. A security agent called CD4.
So I guess it's in the cells of the body.
It's in the cell.
Okay.
So which is it's a cell in the body.
It's a cell in the body.
Type of security in our body, and which is part of the defense system of the body. Now, when HIV gets into the body, it attaches itself to this particular cell. When it attaches itself to this particular cells, it finds a way of embedding itself in the cell. When it embeds, and it uses some agents, some chemical agents from that cell to embed itself. When it's embedded itself, it changes the chemical composition of that cell. And then it will use another chemical agent to produce a lot of itself. Of HIV, will produce a lot of itself. Now, when it's produced, they come in strengths, long strengths. Then it will use another chemical agent to cut them into smaller pieces, the size of itself. Then it will use another chemical agent to release these cells, these new viruses, into the bloodstream. Now, when the body realizes that, the body will produce more of the cells to fight HIV. And then as soon as they are released, these HIVs, which have been released into the system, will go through the cycle with each one they infect. So there's a fight, there's a struggle. And this can take weeks. So during this period,
the individual that
has been infected. So you realize that when someone has HIV, most often they don't have any symptoms. They look well like you and I. It will take years, some people up to 5 to 10 years or 15 years before it's realized. By then the immune system is broken down. They are ill with all sorts of conditions. We call it a late diagnosis. But in the beginning, if for the first few months it's identified, then it's better. So more is released into the system. It attacks more of the cells. It uses the same process to reproduce. So HIV reproduces itself by using that cell called the CD4 cell. It reproduces itself by using them as a factory to produce more of itself by using certain chemicals. And there are about 6 stages of that. So
before we probably go into the stages, I mean, the last time we were treating cancer, we talked about cells. And the resource person was talking about how the cancer cell, the body has some checks in place. And so normal body cells are able to, grow, finish off as in die off, and then they replenish all the body, and like it's a healthy cycle going on. But the cancer cell keeps multiplying. The abnormal cells that keep multiplying and producing their same kind of cell, which spreads to other, and that is where the problem is. So I'm just trying to clarify here because it sounds like this infection it's a bit different from that kind of,
Yeah,
because I
it
have
is.
people following on and trying to build on and making sense out of the whole cell situation. So in this case, we have a normal cell
Yeah.
which has been infected by
Invaded by an HIV,
yeah, and then it takes over
It takes over the cell
and tries
and
to
uses the cell, which is called CD4. It's important for people to know about CD4 because when they go to the hospitals, these are markers which are
right.
used to determine the blood test whether how it's doing. So it's good for them to know. It's called CD4 cell, T cells.
So is that the test that they will be doing then?
So it's done all the time. It shows how your immune system is doing, whether it's doing well or not. So that's a test that is done. Yeah.
Right.
So it uses the cell, the CD4 cell, as a factory to reproduce itself. It uses about six stages, using different chemicals to do that. And when it has reproduced itself, it releases them into the blood, and then they also go and look for more CD4 cells to infect. So it keeps multiplying, it keeps replicating itself and keeps multiplying until there's an intervention.
I see. Is that why other infections can be treated and dealt with, but HIV cannot be?
So HIV is a virus. There's no cure. It can only be managed. It can only, the person can be given treatment. There's no cure. You know, because it's something which replicates itself. There's no virus which has a cure. Common cold has no cure. So viral,
it runs its course and just disappears.
Exactly, but HIV, HIV does not. It stays so long as the person is alive. He's a living being. The virus likes a living being.
Right.
So long as the person is alive, HIV will still be there.
And it will still be manufacturing itself.
Will be manufacturing itself. Use the cells, the CD4 cell as a factory, and continue to reproduce itself.
So you were earlier on trying to go into some stages of the, the disease process. What stages were you going to?
So I mentioned that the virus goes through about, it's the virus, not even the disease itself. The virus uses 6 stages to reproduce itself. So, and that's what I've mentioned. And it uses certain chemicals. I don't want to, they are big names, we don't need it. But all we need to know is that it uses certain chemicals at about 6 stages when it has invaded a single cell to reproduce itself.
Right.
So the current treatment we have, what scientists have done, is to look at the various points where HIV works, the 6 stages, and have produced medication.
Right.
So the medication given will fight each stage.
Does it break the cycle?
So it breaks the cycle. So the medication, the medication comes in different forms and they are individualized depending on the person. So what happens is, it can come about 4, it's called combined medication. So they've used the names of the various stages where HIV, works and uses it as a factory to reproduce itself. And then, so each medication works at each stage. So for instance, if someone is given medication, it could be about 3 or 4 medication combined into one medication.
And they need all of them.
And they need just one medication, which has about 3 or 4 different medication combined.
Oh, I see.
And that one medication will work on those cycles to reduce the rate at which HIV is working. Others, because they are individuals, may have to take individual medication. So they may have to take about 3 or 4 different types of the medication. Each of them is working at each point. And as they work, they frustrate HIV and then break the cycle and reduce the rate at which they are multiplying. And then eventually what happens is that then HIV levels go very down. They go down to a certain level called undetectable. You cannot detect it. That's what the medical term used. It's undetectable, meaning that it is at a level where the rest of the virus cannot be removed. But they are, I use the word in coma. If someone is in comatose, the virus is in coma. And they will continue to be in coma or unconscious so long as you take your medication. So long as you take your medication, the virus will be at that level. If at any point you stop taking your medication, what will happen is HIV will become active again, will produce certain chemicals against the medication you were taking. So you become resistant to that medication.
Right.
So then if you decide that, okay, now I want to take my medication, it may not be working. So you go to the clinic, they do various tests, and you'll be told, oh, you are resistant to this medication.
Right.
We will have to
Because
change it for you.
it.
Because you had a break. So we'll have to change it for you. But if you continue to do that, what will happen is, at a point in time, you may run out of options. So it's best to just stick to your medication.
Yeah.
Yeah, it's very important. Yeah.
Yeah, that's deep, actually. Yeah, so before we continue, because I'm loaded with a lot of information, just so you know that we are bringing you this via on Facebook and YouTube by kind courtesy of Omega House Multimedia, who has given us the platform to have all these health professionals here to talk to us about all the conditions that we encounter. Omega House Multimedia, we can reach them on 189 Wood Street, E17 3NU, and also at 74 West Green Road, N15 5NS. So I'm thoroughly enjoying this session, what we are going through, but just stay in tune, stay focused. I think it's a bit deep at the cell level, but it is very important that we stress on the fact that it is an organism that is, has a cycle.
Yes.
And it's not just like one phase and that's it. Because of how it goes through cycles, it determines your treatment options, and it determines how well you progress and all that, isn't it? Very important.
It does.
So yeah, I think that is quite clear how it is. So how is it transmitted from one person to another?
Yeah, so HIV can only be transmitted if you have unprotected sexual intercourse with an infected person who is not on treatment and it's not undetectable. So having sex with an infected person, you can get HIV. Sharing, injecting needles and so on, sharing skin piercing instruments and sharps and so on, you can acquire HIV. Also, you can also, mother can transmit it to the baby.
Right.
Yeah. And so the most important thing is unprotected sexual intercourse with an infected person. Be it male, be it female, be it vaginal, be it penile, be it in the anus, you can get HIV. Infected blood transfusion, and most often blood is screened. It's on the past, when HIV was new, a lot of people got it from blood transfusion. But currently it's very difficult to get it from blood transfusion, and people are only transfused when it's absolutely necessary. From infected mother to her unborn child, a person can, and then sharing infected skin piercing instruments. So the key word is infection. Is the fluid getting into you infected or not? And how would you know that it's infected, which is very important.
Right. How would we know that it's infected? So the mother-baby transmission, is it that the mother knew? Can it be transmitted when the mother is known to be HIV positive and is already on treatment?
So currently, we have enough evidence showing that if a mother is HIV positive and is on treatment and is complying with her treatment, it's very difficult for her to pass HIV to her baby. And currently we have lots of mothers who have had their children whilst they are HIV positive. Their partners are not, or their husbands are not even HIV positive, or both of them are HIV positive. But their children, all the children being born now, are all HIV negative. Wonderful. Because they are complying with their treatment. And they look normal, they are going about their normal duties. No one will tell, unless they tell you, you wouldn't know.
Yeah. The internet is going crazy on this topic because I have a lot of people watching on Facebook and asking us a lot of questions, actually. Yeah, so this program was meant to be like a phone-in initially, but the response wasn't that great, so I just decided to focus and have my guests to go through the topics. But tonight, it looks like people are going ballistic on here, so I'm going to have a look. So if you're watching me, AC Hammond is asking, when HIV is in coma, so as in, according to what he said,
Yeah.
does it mean sexual intercourse with someone who doesn't have HIV is not risky? Which is a good question, just based on what you just said. And she says, is the HIV in the state of coma not infectious? That's a very good question,
Yes.
actually.
Yes. So that's the term I use instead of using the word undetectable, which is the medical
That is the
jargon.
medical jargon
Yes.
for it.
So I would say that that's all that it means. It's dormant.
Yeah.
It's not infectious because it cannot reproduce itself in that state.
Yeah.
So when a person is in that state, they cannot transmit HIV. There's enough information. It's called U equals U. I don't know how many people have heard, but
I haven't heard that before.
U equals U. If you Google U equals U, it will just come.
Yeah, U.
It is undetectable viral load. So the amount of virus in a person's system is called a load.
The viral
so the viral load.
Right.
And that is also measured in the clinic. So it's important for people living with HIV to know that there's a viral load and there's a CD4 cell count. So the amount of virus in the system, so he's saying that if the amount of the virus in your system is at undetectable levels, you've had that in a sustained way for about 6 months, you don't have any sexually transmitted infection, and for 6 months or more, your viral load has been undetectable. In a comatose state, as I call it, you cannot transmit HIV.
You cannot.
And there's enough evidence out there to prove that you cannot transmit HIV.
So this is just evidence-based practice.
It is evidence-based.
Yeah, it is evidence-based, but the key thing is the person who is infected should have the viral load like at its lowest.
Yes.
That's the undetectable state, isn't it?
Yes.
Yeah, and that is when you can even have sex with them without a condom.
A condom, and you will not. The one who is not infected will not get. So it's U equals U means undetectable viral load equals untransmittable HIV.
Undetectable
viral load equals untransmittable HIV.
Wow.
Yeah. So it's something. It's not everyone who knows, and that's why I was keen to share this, because people do not know about U equals U.
No, I didn't.
Yeah. So you cannot transmit it.
Yeah. Okay. And I also have a viewer, Charles Quist, Mr. Charles Quist. He says, what about if the person has mouth sores and bleeding gums? And I guess if they have a case with somebody who is infected and who has not got an undetectable viral load, are they at risk?
So the current evidence we have is that HIV usually will not survive in an acid medium.
Right.
So if for some reason you swallow someone's blood from kissing or whatever, it must be quite a lot of blood. We have evidence that you cannot get HIV unless actually you are drinking blood. Otherwise, it's difficult to get HIV. Right. And also, if the person has, like you said, the most important thing is the person on treatment. Are they complying? Are they undetectable? If you are not sure of your partner, just avoid.
Right.
Avoid it.
If you're not sure, just avoid.
If you're not sure, just avoid it.
Yeah. If with your partner, that's gonna be.
Well, if you've got sores, it means that there's a form of infection. Maybe so the person hasn't got HIV, but I don't think we are not sure. It could be their systems have run down. It could be stress. It could be anything. So just avoid it if you're not sure.
I have so many people watching this one. Everyone is interested in this topic, HIV. So I have Josephine Ghani, I have Theodora Kukwa Bennett, I have Kofi Akwa, Cecilia Enin, Hannibal Diaba, Alberta Isaba Hagan, Irene Alomenu, Evelyn Quayne, lots of people watching, and they are all bombarding us with questions. So just stay tuned, and we will carry on.
Questions may be
your questions may actually come up as we go on. So can you acquire HIV from sexual contact, from casual contact? I think we answered that earlier on, isn't it?
That. You cannot get HIV from casual contact. If I give you a hug, if I give you a kiss, if we are seated in the same chair, if we are lying on the same bed without sexual intercourse, if you are using the same bathroom or toilet, you cannot transmit HIV. HIV lives in a human cell. It lives in in a living being. So it's very difficult to get HIV. The evidence we have for people, all those living with HIV, over 80% of them got it from unprotected sexual intercourse with an infected person, either from their anus, from their vagina, or through the penile insertion.
This anus thing, is it becoming very popular, is it?
Well, that's how people want to express their sexuality, and I know we've heard of women who enjoy it, and if that's how you cannot judge, you cannot.
No, you
but
can't.
all that we are trying to say is that
Absolutely
if you are involved in that, you can also get HIV through the anal intercourse. So in the past, we used to talk only about vaginal intercourse and penis, but now the penis and the anus can also cause it. You know, because there's a lot of blood when people are having anal intercourse and so on. So it's their choice.
It is their choice, but just so you know, it's another route that you can
get
through.
HIV.
Yeah. What's the difference between HIV and AIDS?
So when we talk about HIV infection, it's somebody who has acquired HIV from what we've discussed. They look well like you and I. They are not ill. They are going about their normal duties. There's nothing wrong with them. When we say someone has AIDS-related illness, now we hardly talk about AIDS, we talk about AIDS-related illnesses. So if someone has an AIDS-related illness, it's someone who has HIV and who is defense system has broken down completely, and they are unwell with all sorts of conditions. We call them opportunistic infections. These are conditions who have taken the opportunity of the presence of HIV to also display. For example, everybody has a TB germ in their bodies, but because our defense systems are very strong, you do not, TB is dormant. TB is also in coma. It's dormant. But as soon as your immune system is broken down, then TB, which was dormant, also decides, oh, now can also come out. So all those conditions will take the opportunity to display. So HIV infection is someone has the virus. They are well, they look well like you and I. They may not even know they have HIV.
Themselves, they would not know.
They may not know. AIDS is someone who has the infection, whose system has broken down and has all sorts of conditions going on. And currently in our communities, we have a problem of people being diagnosed late. So we call it a late diagnosis. So they are not tested early. They don't access the services available. So by the time they are unwell, they've been to hospital several times, and eventually someone said, look, let's test for HIV, and then they are HIV, and it's realized that they have HIV. Some ends up with all sorts of cancers. This ends up with it's really sad. It affects their brain. Some even have mental. They end up in mental institutions and so on. They are not the same. Eventually, even when the HIV has become undetectable physically, they are affected. And also they may have all sorts of deformities and so on. So the best thing is for everyone to go and test. You will go through a risk assessment. You know, I'll talk about risk assessment.
Okay.
It's very important.
You know, a long time ago, in the very first hospital where I worked in the UK, obviously I had just come from Ghana, working here, and I remember on this ward, they brought a patient in and they started mentioning the signs and symptoms, and I just thought that obviously I was a fresh woman in town. I didn't want to say much. I wasn't sure how my English was going to even sit well with them, so I thought, you know what? I called the ward manager and I said to her, this presentation is quite clinical to something I've seen before. And obviously coming from Ghana and the area where I worked, I had encountered a lot of patients with the condition. So I knew hands down. And I suggested to her, I said, I don't know, but because it will be in their best interest, isn't it? And so not saying it wasn't going to be any good. So I mentioned, I said, it will be a good idea probably to suggest this. And they did. Like fresh nurse in town, fresh staff nurse from Africa. And I said, please, 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 this is something I've seen before, because at that time it was almost near in the AIDS stage. Yeah. And they listened to me. I will never forget that. They listened to me, did the test, and then by afternoon time, we had a call on the ward, and the person was positive. And it was like, oh, look at this one.
Experience.
Like, really? And they're like, did you train in the UK? Of course, no, I trained in Ghana. But yeah, because I knew I was very familiar and it was quite clear. And they were really impressed. That I think that was like a tick.
Yeah.
Can we just go through the signs and symptoms, if there are like clinical things to watch out for?
So most often, because the immune system has broken down, the person may end up with a loss of body weight, or the person may realize they are losing weight with no meaning. They are not on slimming course, but they realize that they've been losing weight from time to time. The people, depending on what it is, may experience diarrhea. You know, so that will also end up with loss of weight, because you are losing fluid from your body. Because their bodies are, the defense system has broken down, and because there are opportunistic infections all around, they will manifest things like TB symptoms. They will have symptoms of all those conditions. They may have sores, they may have skin conditions, and so on. And so currently, if anyone is suffering from any of these, it doesn't mean the person has HIV. It's important. So people don't start looking at people and saying, why are you losing weight? No, the person must go for a test. It could be cancer. It could be something else. But the commonest thing which we find these days is a lot of confusion, mental confusion. The person is confused. The person, cognitively, they are not there. So this is one of the things. So the person appears confused, the person, is losing weight, the person has skin conditions, a whole lot of things. The best way.
At that stage, with these, is it in the AIDS phase, or it can still be?
So they suffer AIDS-related illnesses. They suffer AIDS-related illnesses. So depending on the type of infection, opportunistic infection in their system, they will manifest. Some will manifest as if they are mad.
Wow.
Mental health issues, they are confused, they cannot think, they ask them questions, they are just looking at you because they have brain impairment, their brains are impaired for one reason or the other, because HIV can go into the brain. So in the past, people, we had the symptoms of diarrhea, we had weight loss, we had all sorts of skin conditions and so on. They are still there, but also there is the fact that the opportunistic infections will also be manifest. The person may be coughing, for instance. If it's TB or some other chest infection, the person may have pneumonia infections. So it really depends. So it's AIDS-related symptoms that may manifest. And if you are lucky to be seen by someone who is experienced, the person may just suggest do an HIV test. Or if you've been to the hospital and you are being told, even if it's a common cold, and someone suggests that, oh, why don't you've been having this flu-like symptoms for some time, why don't you go for a test? Don't be offended. It's a favor.
One thing I
just
noticed
go and have it.
Back then was how simple things persist. Persist. So you have, say, food poisoning, and normally you would get through it over a few days, and then your bowel restores you back to normal. But then, when anything is persistent, you have a skin rash, you try and treat it, it doesn't go. So it is basically all the things that happens to us on a day-to-day. That's why you are mentioning opportunistic infections, isn't it? So everything that can normally happen to us, we deal with it because it's taking over the
it's taking over your body. It's using your immune system as a factory to reproduce itself. So if you are treating something and there's you are not responding to treatment, you can even suggest it to your doctor or just go. And in the UK, for instance, we have confidential testing centers, sexual health clinics. confidential.
Strictly
Confidential, you know. Just go, it's free. Just go and say, oh, you've come for a checkup. They will offer you a test for gonorrhea. They will offer you a test for syphilis. They will offer you a test for chlamydia, and they will offer a test for HIV, because these are the conditions you may have but may not have symptoms. So they will offer you this. And then if, for example, you say you've lost your period, they may then do a pregnancy test. So it's free and confidential. I know people say that, oh, I don't want to know. But you also don't want to sit down till your body is invaded, taken over by a virus, and then now you are bedbound, you can't go anywhere. Is that not when people are going to talk more about you? Compared to if you had gone earlier, been checked, on treatment, working well, you are still going about your normal duties. What will people say? So just look at the analogy. It's better to go and just go by yourself, go and have a check. If you have it, we have treatment which works. It works, you know. So
and it works. That is the key thing. It does work.
It works.
Nana Sarah Ambufa, you are watching us live on YouTube and Facebook, and you say, is it likely that a person with HIV will live a long, healthy life?
So currently, evidence tells us that people living with HIV have the same normal lifespan as everyone else. Just that everyone is different.
Right.
So somebody who has HIV, maybe if it hadn't been for HIV, would have gotten cancer, and maybe would have died from cancer. So people living with now, HIV is a chronic, manageable condition, and therefore, if you decide that you want to take your medication, you want to live your normal life, you can live. People are dying who don't have HIV. They are dying from road traffic accidents. They are dying from cancers. They are dying from all sorts of conditions. They are dying from heart attacks. People living with HIV are still alive
and living
so up for
normally.
Death. So everyone is different. It depends on how you manage yourself and you take advice, and so it's individualized.
So you can live quite a healthy.
You can live a healthy life.
It depends on how you look after yourself.
Your lifestyle.
Your lifestyle and everything.
Nutrition and everything. And some people eat well. They look after themselves. They can be living with HIV for 10 years and they wouldn't know until later. So everyone is different. So if you know you are sexually active, you know that there've been a quick one here and there, just go and have a checkup.
What about between like regular partners? If I have just one partner, and
it's about trust. So if you have a regular partner, you trust each other and you are faithful with each other, I don't know why you would want to be scared. But then, before you met that partner, you must have had a partner before them. Did you know your status after you've left that partner before coming into this relationship? So you need to check. So I will usually advise people, if you've broken up from a relationship, go and have a checkup. You go through risk assessment. So sometimes they will ask you, why don't you come and check again in 3 months? Check again in 6 months, check again in a year, and then you know you are clear, you don't have it. And then if you are going into a relationship, you can confidently ask your partner about their HIV status and whether they've done a test, or you can suggest you should go and do it. So it depends on, it's about trust. So if it's a trusting relationship, and none of you do not have HIV before you met, and you are faithful with each other, I don't see how you will get HIV.
So if along the line, if one of the partners becomes positive, because obviously we can contact it through other means, say blood transfusion, needle stick injuries at work, for those of us who are health professionals, then what scenario is that? How do we manage that?
If you are a health professional, so what happens is that if needle stick injury, there's protocol which manages it. So if you get a needle stick injury at work, immediately you're supposed to go to the sink and squeeze the area.
The health professionals, this one is exclusively yours.
Yes, squeeze the blood, squeeze as much blood as you can. Squeeze it as much as you can. Cover it. Let your in charge know. and then go to the occupational health department and report that you've had a needle stick injury. So what they are going to do is to immediately take a blood and test for HIV,
Right.
because the needle stick injury you had a few minutes or an hour, a few hours ago, will not
manifest
itself
immediately.
within 2 weeks
Yeah.
or so. So if they do an HIV test and you are HIV positive, it means that you were already positive. It also depends on who you got the needle stick injury from. Is the person infected? Is the person undetectable? Or no, if they are infected, what's their viral load level? And this will be taken into consideration.
Yeah.
So you do the blood test, and then depending on what it is, they may decide that you should start taking what we call PEP, post-exposure prophylaxis. You take it for
exposure prophylaxis
because you've had a needle stick injury. So it's called PEP. So they may, they will do a risk assessment. They may say that you should start taking it, depending on the patient. So if the person you got the needle stick injury from is not undetectable, and the person viral load is very high, they may start you on it, because there's enough information saying that that can stop HIV from progressing. Yes. Yeah. So after that, they would ask you to come back again and do another test. And now we have tests that can show that you have HIV within a minute.
Okay.
And then another sample will be taken.
Over-the-counter kind of tests, or you still have to go to the hospital?
You just go to a confidential HIV testing center.
Safest way to go, isn't it?
That's the safest way to go. So health professionals squeeze out the blood as much as possible, cover it, go to occupational health or A&E, tell them your story, they will take you through the protocol. But the most important thing is, what was your status?
What was your status
before the needle stick injury? And therefore they will test you. Yeah. Yeah. So if you already had HIV, you cannot say that you got it from that patient.
Right.
Yeah.
Right. Okay. Yeah. So the people are still going wild on there. They have so many questions for you.
Oh, bless.
Just so you know, you are watching this live on Facebook and YouTube. Share. The key thing is share, post, like, do whatever you can to get your people, your friends and family watching, because this is it's an everyday life thing, isn't it?
It's very real.
Important, and it's real as well. So it's very important everyone knows the subject, isn't it? Very, very important. Yeah. Alberta Awochi is asking, she's been one of my resource persons previously. Yeah. She says, what is the law in place for those who know their status and go around infecting others on purpose?
So
good question, that.
Yeah. So currently, you must be able to prove that somebody
I hope you're
intentionally infected you with HIV. If you're able to prove it, yes, there's a law which will take its process. The law will take its course, and then whatever needs to be done will be done. But you must first prove that the person gave you HIV.
Yeah. Because obviously you must be able to prove that you are sure that it is that from that very source, isn't it? And you've not been anywhere else.
Because remember, we have U equals U. So if the person has been undetectable, sustained undetectable for over 6 months, and they check their medical records, they've been undetectable, there's enough evidence saying that they cannot pass on HIV. Yeah. And you need to prove that that person gave you HIV. Yeah. You need to prove it.
Wonderful. You are all going wild here, but I think we will carry on with the questions. It says we have to talk about the treatment options, isn't it?
Yeah. So before we talk about the treatment options, let me go through a risk assessment.
Risk assessment, very important.
So you need to individuals must risk assess themselves. One, when did you last have sexual intercourse? These are questions that will be asked at the clinic. You've gone to the clinic, you want to have a test. They don't just do the test. History, they will take the history and do a risk assessment. So when did you last have sex? Did you use a condom or not? Did you know the status of the person or not? And then they will also ask, when did you last share skin piercing instruments with anybody? Because now we know that people involved in drugs may inject themselves, they may share needles and so on. They will ask, when were you last transfused with blood? And I know that in the past, if you in an audience, if you ask who has been transfused, sometimes no hand will go up because no one has been transfused. So very few people.
Right.
Current information, over 80%, over 85% of people get it from unprotected sexual intercourse. So they will take you through sexual intercourse, sharing of skin piercing instrument, blood transfusion. Have you had any sexually transmitted infections? There's enough information saying that if you have a form of sexually transmitted infection, you can easily catch HIV. So they will take you through all that. So it's called a risk assessment. It also helps determine the window period. We have a window period for HIV.
Yeah.
Within that period.
Yeah, you probably have to break that down a bit. What window?
So a window.
Yeah.
Within that period, if someone is infected with HIV, the test will be negative.
Right.
It will
is
not
that
react.
From the time of the
from time of infection till the time the person tests positive.
Yeah.
Is called a window period.
Right.
It's a window, just the word window.
Yeah.
Yeah. So, and currently we have, the tests are so sensitive that within 2 weeks to a month
of infection.
2 weeks of infection to a month, the test can detect if you have it, compared to in the past when you have to wait for about 3 months or 6 months. Now within 2 weeks. So they will do, when the risk assessment is done, the person may be asked to come back maybe in a month's time or in 3 months' time to have another test, because the person may be infectious, but because it's a window period, the test says negative. Based on what you've told them, they will advise you and say that, okay, to really know that you have it or not, why don't you come back?
Definitely.
For another test, so you are sure you don't have it. So there's no point in hiding or lying. Just be honest, just be open so they can help you. It's a confidential service.
It is a confidential service. And whilst you're watching and so keen to ask me all the questions, don't forget to like our page on Facebook and on YouTube, and share with your friends. Very important, very important. Like I've always been posting, you could save a life. You could save a life.
You could.
Yeah, definitely, because all the other opportunistic conditions join in to make you a miserable person and make your condition even worse. So it is extremely important that you share.
It is
so
important.
Like our page, Irene Alomenu is asking again, what does the CD4 count become? It says, when does the CD4 count become undetectable? When?
So the CD4 cell count is a measure of your defense system or the immune system for health workers. So that one, it should be higher. The average is about 500.
Okay.
And so it ranges from about 500 to 1,600. So on the average 500. And that determines a measure of your immune system.
Right.
When HIV has invaded your defense system and destroyed the CD4 cell count, it could go as low as 1.
Wow.
1. It could go to single figures. That person has AIDS-related illnesses. They are really very unwell. They are confused. They have a whole lot. So the CD4 cell count should always be high.
It should be high.
It's a viral load which has to be undetectable. And the undetectable, at least in the UK, undetectable, we say that if you are below 50 copies, the viral load can go into millions. Because the HIV replicates itself, it's infecting more cells, and the higher they are, the more ill you are.
Right.
So when the viral load is below 50 copies, we say the person is undetectable. So when the person living with HIV goes to the clinic, they should not leave without asking about this if their doctors or nurses do not tell them. The last time I was here, you did my blood, what's my viral load? What's my CD4 cell count? So the CD4 cell count will tell them how well their immune system is doing, their defense system is. So that one should be high. The viral load should be low. It should be, they will tell you maybe it's 45, it's 20, it's 10, it's 1. So the viral load is what makes you undetectable, not
Yeah.
the CD4 cell count. I
Right.
hope I've made it clear.
But if you are confused and not clear, go to the clinic, go to the professionals.
Yes.
Let them do the interpretation for you.
Or
It will
just
make
Google
life-
it.
Yeah, or Google. Yeah.
Yeah, use
sometimes you are so
your
scared.
phones. Just Google it and for yourself and learn more about
Yeah.
it.
Key thing here I can figure out is the help that you will get once you have been diagnosed.
Yes.
Isn't it?
A lot
So
of
can you
help.
go through that?
So-
Obviously, we know they have to go to the clinics to get tested.
Yeah.
Yeah, but there is the aftercare, that people may be interested in. Yeah, we have already said that confidentiality is a must, and
And
they
it's
should
there.
not be worried.
It's there.
It's there.
Yeah.
So they shouldn't worry about confidentiality because they are safe.
Yeah.
Yeah.
And even if you know someone at the clinic, you've seen someone, they know that as professionals, they cannot go out and tell
Disclose,
anybody and
exactly.
disclose. They can't. Yeah, they can't.
Yeah. So how do they get
So
help?
when someone has been to the clinic, they'll take them through pre-test counseling, pre-test of HIV counseling, and that involves the risk assessment and so on. So your mind is prepared as to what you are there for. So when we do the test, within a minute, the result is out. If it's positive,
Well, within a minute.
1 minute.
What? It's instant.
Instant test within a minute.
Wow.
It will
Times
tell
have
you
changed.
it has changed
Right.
a lot.
Okay.
So within a minute, it will tell you whether you are HIV positive or not. So we call it will react or non-reactive. So then blood will be taken from your hand in a bottle and sent to the laboratory to confirm that test. If it says non-reactive, the blood will not be taken. Based on your risk assessment, you may be asked to come back another time to repeat the test for your own sake. But if it's reactive, then blood will be taken and sent to the lab for confirmation. So when you are reactive, then they will take you through post-test counseling and tell you that this is what has happened. It appears, and the test is so sensitive that sometimes there are false positives.
Right.
So, and that's why it's important, So usually, if it's negative, then we know that it's non-reactive.
Right.
But if it's positive, occasionally there could be false positive, and that is why we take another sample into a bottle, taken to the laboratory for testing. And then, but for the time being, they know that most often when it's positive, it could be positive.
Yeah.
So then you go through post-test counseling, what has happened. Lots of blood will be taken to check all your systems. We take lots of blood to check all your systems. All these, so you'll be referred to the HIV clinic. And at the HIV clinic, you'll be seen by a nurse who will take you through, what you've just been told and so on. Take lots of blood. You'll be given an appointment to come back, usually within 2 weeks. All the results, including resistance. Now, I spoke earlier on about resistance and the fact that if the virus releases chemicals to resist the medication you are taking because you don't comply, you don't adhere, you take it today, tomorrow you don't take it. So what's going to happen when there's a resistance? If that person who's not been taking their medication has a resistance HIV and they have sex with somebody who hasn't got HIV, the person can transmit the resistance HIV to the person who is now newly infected. So when the person's blood is checked, they could say that, oh, she's already resistant to some of the medication.
Okay.
You see, I hope it's not too deep.
No, it's not.
It's
quite clear.
It's important
actually.
that people taking their medication should take it anyway.
Important.
So you'll be taken through. So within 2 weeks, all the blood samples will come, including a resistance test. So the resistance test and some other allergy tests and so on will determine as an individual what medication you need to take.
Right. Okay.
And so then you are taken through the medication and what's going to happen, how you should take it, and so on. And it's also confidential, and it's a compassionate service. It's not there to judge people.
No.
They are not there to ask how you got it doesn't matter. What matters is you've got it. How do we move forward? How do you go on with your life? How, you know, what are you going to do with yourself? How are you going to share the information with your sexual partner? It is a confidential and a compassionate service.
I can tell. I can actually tell from the way you are even going about it how much of a compassionate service it is and how it is done. And so your secret will be safe. You don't have to worry about that at all. And the care will be top drawer as well. Yeah, because you can tell that she's fully loaded with compassion. I can tell. Yeah, which is great. So in terms of cost, I mean, I know everything about it is a free service, but like the last time we were doing cancer, we realized that the cost of these medications, it's big. Like cancer treatment for about £20,000. They were saying, how is the cost for this one?
It's free.
It's free. I don't know about Ghana. I have a lot of people viewing from Ghana. I don't know, but is it a World Health Organization thing for it to be free? Or
I think it's country by country. Right. I know that when I used to be in Ghana, I know that I was working in the same field. I know that you had to pay a little bit of money.
Right.
Just to maintain the machines, and that money should cover your blood tests, it should cover the medication you receive and so on. It was just a little bit of money. I don't know how it is now, but here you don't pay anything at all. It's just to encourage people to take their medication. And even if you are a visitor to the UK and you know you have HIV, you are running out of medication, go to any HIV clinic or sexual health clinic and say that, you are on medication, you are from here. They will not say, oh, you are going to be deported. It is not an immigration center.
No.
So no one is going to go take you through that. They only want to know where people are coming from, but they are not going to send your details to the Home Office or anything. You will get free treatment so long as you are in this country. It's one way of protection, protecting
because you are protecting the population. Isn't it?
So it's free. You don't pay anything. Yeah, nothing. You don't pay. You don't pay anything. The only thing you may pay is if you go to a sexual health clinic and you say that you want an HIV test because you're going to get married, or you want to use it for something. They may ask you to pay maybe about, is it £10 or £20? That's it. But if it's just testing to know your status, you don't pay anything. It's a free, confidential, compassionate service.
Yeah, it's free. So that's the good thing about it. It's absolutely free.
And if you're a visitor in the UK, don't hesitate. Don't hesitate at all.
That's very good information.
Yeah, don't hesitate. It's to protect the population. Go to any clinic, sexual health clinic, HIV clinic. All they will do is to confirm that whether you really have it, and they will give you free medication.
Wonderful. That's absolutely wonderful. So how can we prevent it? Is there any way? We've said so much about this. How do we prevent it?
So I think for me, one of the ways of prevention HIV is creating awareness like we are doing.
Yeah.
It's very important for us to create awareness about the condition, about what is happening, about testing, about treatment options, creating awareness about the fact that you don't get HIV from hugging people, you know, being nice to people, being sweet to people. After all, we will go to restaurants and so on. Do we know who ate in the plate and so on? We go and use the same plates and cutlery.
Yeah.
Otherwise, some of us will not be working in an HIV clinic if it's that easy to get it. No one will work in an HIV clinic. So creating the awareness is very important. The other thing is, it's important for people, if for some reason if they don't have to have sex, they shouldn't. If you don't have to, but if you have to have sex, it's important that you use a condom correctly and consistently. One of the ways,
keywords, correctly
and consistently. correctly
not
and
anyhow.
consistently, not anyhow.
Yeah.
So if you go to the clinic, they will show you how to do it properly, because sometimes you have people coming and saying that, oh, the condom broke and this and that. It shouldn't happen. So you need to use it correctly and consistently.
I'm gutted we didn't bring a model of, to show the correct. It's
That's
important.
True. It is.
Very important, because we could have, people are already shy coming forward for these kind of tests, which is understandable. But we should have seized the opportunity. So I'm sure I'm going to get you back here. The next time you should have show people how to wear a condom properly, because it's very important, isn't it?
Yeah, it is.
Yeah, it is very important.
Yeah,
so
it is.
If you joined us, let me just chip in. This came to you by way of Omega House Multimedia. They have given us this opportunity to telecast this live, and they are into media works, covering all your events, your good events, as in weddings, even funerals, you name it, they do it all, and they are the best in the business as well. And if you want all your souvenirs, party favors, everything, they do amazing job with it. So you can find them on 189 Wood Street, E173NU, and you can also locate them on 74 West Green Road, N15 5NS, and that's Omega House. Yeah, they've done brilliantly by giving me the platform to get all the professionals here. How on earth was I going to know about all this? Yeah, so if as a health professional doesn't know, you can imagine. So we will try and get to the bottom of it. But you wanted to say something, right?
So let me prevention. So I've talked about creating awareness, abstaining if it's possible for you. Testing is one way of prevention, because then when you test, you know you have it, and you know there's change in behavior and all that. It's also important for people to know that when they are on treatment, they have to take their medication. Adhere to them. The word adherence is used in HIV circles because it's sticking to a particular regime and observing everything that goes with it, including whether to eat before taking it or not to take it with food and so on, complying with all that. It's also important for people to know that undetectable viral load is equals to untransmittable HIV, and therefore U equals U is working. It's also important that we try not to stigmatize.
My producer has to put that on here. Undetectable viral load is equal to
equals U.
U equals U, right? And
if you go on break, I'll quickly.
Undetectable. Don't worry, he'll do that for us.
Yeah.
Undetectable, because it's very important.
Yes.
Yeah. Undetectable viral load is equal to
untransmittable HIV.
Untransmittable HIV.
Yeah.
Yeah.
Tackling stigma and discrimination in our communities, because you realize that as soon as people hear that someone has HIV, their attitude towards them change. So we have people who are scared to even take medication in the presence of family members or friends and so on, because they are scared of stigma and discrimination. So if we don't tackle stigma and discrimination, people will continue to hide and not disclose to their partners. But if you disclose and people understand that talking to you or sharing ideas with you, sitting in the same church with you, being in a family meeting, you don't get HIV, you don't get, it's not easy to catch it. So tackling stigma and discrimination in our communities is very important. And we believe that currently U equals U is one way of reducing stigma and discrimination in our communities, because then you know that if the person is undetectable, they don't even have to use a condom to have sex with their partners. Wow. So it's very important. And then faith and HIV, as much as possible.
Faith as in religious?
In religion.
Right.
Okay. And HIV. So that's a big one.
Big one.
Where people refuse to take their medication because they are saying their priest or their pastor says they shouldn't take it and they'll be healed. And therefore they stop taking it. Also, it's just a misconception, misunderstanding of the word undetectable. So if you are told you are undetectable at the clinic, you are being told that the virus is unconscious, it's in a comatose state, and they cannot reproduce themselves so long as you are taking your medication. That's all that it means. It doesn't mean that you are HIV negative and you are cured. Before you can be told you are you are HIV negative, go back to the clinic and let them do the initial HIV testing. The one that was tested for you to be told you have HIV, that's the one that needs to be done. Because if you're undetectable, when you do that test, HIV will still show. Right. But I also I'm not saying that if you are, you believe in faith, you cannot be cured. It's possible. I've heard and seen, heard people on television and so on saying they've been cured of HIV. I'm not saying it's not possible. But before you can say you are cured, because your pastor says you shouldn't take your medication and you are cured, you should go and do another HIV test. Yeah. And then if you do that test, not
enough, probably.
If you do that test and you are told that you are HIV negative, you don't have, then you can boldly say that you don't have it. Otherwise, we have people who were doing so well, they were told not to take their medication. Now their systems have broken down and they have all sorts of complications.
Yeah. Yeah. So few more questions coming in, and we have the equation U equals U on our screens. Our viewers can see that. So yeah, if you want to ask any further questions, even after the show, I still have contact with my resource person, so we can still handle some of your questions, because there are so many of them coming up. And AC Hammond is my big sister, you know. She's causing trouble on here. She says, isn't HIV clinics a distinctive to people going there for help? Oh, I see.
So that is where the stigma and discrimination comes in. What is wrong with people going to a diabetic clinic? Exactly. What is wrong with people going to a chemotherapy clinic? What is wrong with people going to a cardiology clinic? Yeah. So what is wrong with people going to an HIV clinic? It's all about stigma and discrimination.
I don't think they've written, it's not HIV
no,
alone.
It's not written
usually
a clinic.
Health, yeah. It's not tagged
no.
because of some of these obvious.
It's the stigma we are talking about, you know. So people are like, oh, everybody, someone will see me going into that clinic, so they will think I know it, so they will not go at all. But just remember that it's you. You want to continue to live your life, you know, without any interruptions with conditions which could have been prevented if you had, you know, gone to the clinic and been taking your medication. And in any way, if you are taking your medication and you are doing so well, you don't have to go to clinic all the time. Here in the UK, some people are asked to go every 3 months, some people every 6 months, some people even every year. Their medications are sent to them by courier, you know, delivery. So they don't even have to go to the clinic. So long as they are doing well, you know. So it depends on how you are managing your HIV. Yeah. That would depend on how often you attend a clinic.
To be honest, it's all about you.
Yes.
It's maintaining you as a person, maintaining your individuality, isn't it? Yeah. When it comes to that stage, it's about you. It's like seeing a pastor going to a nightclub, and it doesn't mean anything. No. It means absolutely nothing.
No. For all you know, he's going to preach.
Have to, to preach to save a soul. Who knows? Yeah. So that, and another person is asking that, is the resistant HIV a different strand of the virus?
Yes, a strain,
Yeah, it is a strain. It actually comes as a result of non-compliance to medication, isn't it? Yeah, that's what brings it about. And then one more person is asking, says some Oki health departments administer the PEP that you talk about. Is it PEP or PEP? PEP. Is it, what's the full name for that?
Post-exposure prophylaxis.
So she's saying some Oki health departments administer the PEP, post-sharp or body fluid exposure following risk assessments if required.
Yes.
Could PEP be 100% effective if administered within the required period?
Yes. There's evidence to show that it's very effective.
It's very effective. All this is based on evidence. It's not, you know, it's legit stuff. It's legitimate stuff. And then we'll probably take one more question from our viewer who is saying, what are the statistics of HIV in the UK? Because we did the worldwide analysis, isn't it? We looked at it from the worldwide point of view. But she is saying that for the UK, and particularly among young people who are vulnerable.
Yeah, so in the UK, I don't have the statistics with me. I had it, but in the UK, you realize that the infection is going down among the gay communities. In the gay communities, it's going down. But when you look at the African communities, it looks like it's still high because we are not going out to test. And then it's also quite high in the 15 to 49 year group. It tends to be low in the after 50-year groups. But we have people infected even up to 70-something years. They are infected with HIV. So among the sexually active group, it's really high.
It's really high.
Yeah, it's really high.
Yeah.
Yeah.
It is scary.
It is scary.
It's scary to think that. So, I mean,
the scary thing about it is people not wanting to know, not wanting to go and test. So if you know you are sexually active, or if you know that for some reason you've been unfaithful to your partner, you didn't use a condom, we hear stories of things happening at funerals, at parties, and so on. Just be bold. Go to the clinic. Give yourself, I've talked about the window period. A month, after a month, or give yourself up to about 3 months, making sure that you haven't had sex or you are using condoms, and go and have a checkup. So that you didn't pick up anything, because then it will be very clear at that stage.
Obviously, knowing is better than not knowing.
Exactly.
Definitely.
That's the best. That's the best. Because in our communities, because of the stigma and the discrimination, people don't want to know.
Wow.
I had someone who said the person said they will never test. I said, if you are negative, that's fine, but if you are positive, it will catch up with you. Unfortunately, it will be a late diagnosis, very unwell, you know, and then sort of destroying the rest of your life, basically.
Do we know the oldest person living with HIV?
Yeah, we have people in their 70s who are living with HIV,
and
we have people who have been living with HIV for 25 years, for 30 years. They've been living with HIV, and unless they tell you, you wouldn't know.
You wouldn't know.
No, you wouldn't know. Their peer, you know, they are supporting their peers and so on. Yeah, so we have people living with HIV for 20 years, for 15 years, and they've complied. They've been undetectable.
Wow.
Yeah.
Wow. What an amazing session. What an amazing, it's been incredible, incredible. I have thoroughly enjoyed it, and I can tell from the comments coming in and all the reactions from people that people have also followed and are in tune with what we have discussed so far. So can we just recap and probably round off?
Yeah.
And the rest of your questions you will have to address to me, and you may have to come back another time to take on some of the other sexually transmitted diseases, and then we can top it up with any questions that I wasn't able to channel to you. Yeah, but if you can just recap on today and
so we've discussed HIV infection, and I have said HIV infection. HIV is a virus, so it's human immunodeficiency virus, and the virus is an infectious agent which uses human beings, living beings, to replicate, to reproduce itself. And I've said that when the virus enters the system, it affects our defense system and uses one of the agents, or I wouldn't say an agent, uses a part of the defense system called the CD4 cell as a factory, and uses stages to reproduce itself, to release more into the system. And I've also mentioned that the current medication we have uses the way the HIV cycle, the current research is using the cycle to produce medication for people, so that the cycle is broken. I've also mentioned that there's a window period. So when one is infected with HIV, within a certain period, usually within 2 weeks, the person may be negative, maybe non-reactive. So based on a risk assessment, the person may be tested again. It will be good for them. I've also mentioned that when the person is infected, it's important for them to comply with their medication. I've also mentioned risk assessment. The risk assess yourself. Have you had unprotected sexual intercourse with an infected person? You wouldn't know they are infected or not, but have you had any unprotected sexual intercourse? If you have you shared any skin piercing instruments? But we also know that over 80% of people who are living with HIV got it from unprotected sexual intercourse, go and have a checkup. Have it checked. If you're HIV positive, it's not as bleak as it used to in the past. There's a lot of support. The treatment is working. You can continue to live your normal life. It's important that you check. You go for a checkup and you are checked. Also remember that we can prevent HIV. You can prevent HIV from creating awareness, you know, talking to other people that HIV is still real, you know, so you have to be careful. We can prevent it by staying faithful to our partners. We can prevent by abstaining from sex. We can prevent it by consistently and correctly using condoms. We can prevent HIV by complying to our medication. U equals U, undetectable viral load equals like untransmittable HIV. It's also important that we tackle stigma and discrimination in our communities. Because people are not coming out to test, or they will not tell you their partners or whatever because of that. So this is just a just.
You know, one question before we round off. One that just dropped into my mind was because I'm always worried when my kids go to the barbers.
Yeah.
You know, I even go to the barbers now, so I'm worried now. Can you get it through that? Like,
so
going for a haircut?
It depends. So the virus doesn't live. Unless there's a living tissue, it wouldn't live. And the barbers, you can also find out how they clean their instrument, whether they are using disposable sharps or if they are reusing, how they are. You should ask questions. So long as you don't have a cut, and so long as you are an infected instrument or device, it's not being used on you, I don't think you need to worry. And also, I've also mentioned that over 85% of people living with HIV got it through unprotected sexual intercourse with an infected person. So that is where the emphasis should be. People should watch their lifestyle, a quick one here and there, you know, going to funerals, all sorts of things happen, going to parties, they are drunk, they find themselves having sex with people they wouldn't have had. So all these are ways of, that's where we need to look at, not the you know, sharing, cutting your nails and all that. They are very rare, they are remote.
And I think the virus doesn't live to survive too long.
It doesn't survive.
Outside of the body,
no, it doesn't survive. It will survive. There's a living tissue. But if there's no living tissue, for what research is saying, within a few minutes, the virus should die.
Wow. Oh, Sister Comfort, she was my senior at Kolibri. Yeah, really? How incredible. I mean, I have totally enjoyed this session. And I can tell from the viewers, my producer is like, I can tell he's buzzing. Yeah, what an incredible, you know, insight into
creating awareness
into the disease, creating awareness. You see, and that is what I have totally enjoyed taking on this role because I didn't think the response will be this incredible. I must take this opportunity to thank you so much. Thank you so much. You are the first person actually who told me I will come on your show and who wasn't even affiliated to like a Fianquanta or to Takrade. Yeah, so thank you so much. You're going to come back, that's for sure. This should go to all our health professionals watching us as well. There is so much information that we can share with everyone out there. And we are sat there sitting on all this information. How are people supposed to know and look after themselves if we don't share? That is my thing, you know. And for me, I decided to do these kind of things because when my mom died and I noticed all the little things that could have been avoided, could have been picked up, I thought, you know, if I had spoken to someone and shared my little knowledge, I could have probably saved a life. So I always post on Facebook, share it, save a life. That's the mission. That's the whole mission. Thank you ever so much for coming. Welcome. The next time we come, I've got a gentleman, my first male host, coming to speak to us about depression. Oh, good. If you are in the UK here, big topic within the past week, massive topic. So I can't wait to go through that either. You know, Africans, we think some topics are not for us, you know.
No, it is for us.
Depression.
Depression.
No, we don't have time to be depressed, but it happens, and it's real. So the next time we come here, he has kindly offered to come and share with us on depression. I am looking forward to that, but I say big thumbs up. If I had a hat on, I would say hats up to you. Yeah, but then I only have my gray hair. Yeah, thanks so much for coming. Yeah, and again, people are showing so much interest in the program. I have somebody prepared to sponsor my shoes.
Oh, that's nice.
I thought, really? Yeah, it's unbelievable, the kind of reception and feedback. I am absolutely buzzing and I'm thrilled. But the most important thing is, please do look after yourself. Work hard, like I always say, but then don't neglect your body. It gives you enough warning signs for you to know when something is going on which is not in the right direction.
That's true.
So I will take this opportunity to say a big thank you to Uncle Joe, my producer, and Sister Ikea Dansua, amazing people. If you didn't give us this platform to do this, how are we going to learn all this? So God bless you. To all my viewers out there, this is where you can come and have all your health news, all your health information. And just before I round off, something happened a couple of months ago in Ghana about a young man who lost his life. It's been trending on a lot of the media houses this week. We saw it in the UK this week. Poor treatment in one of the hospitals in Ghana, and unfortunately he lost his life. And I saw the clip and I thought, you know, as nurses and as health professionals, we are the patient's advocate, you know. So if they come and have such a horrid experience, then what are we doing? Every good work that we do will follow us one day.
That's true.
Every good work we do. So I will encourage us, if you are a nurse watching me, if you're a doctor, any health professional, the work that we do will go a long way. I mean, I've had people that somebody I delivered like 25 years ago, messaging me to say, I'm a lawyer.
Oh, that's nice.
And I was thrilled. Every good work that we do will follow us one day. And we can't let people, it scares us, isn't it? Those of us who live us to think that we may want to go and live back home. But that is the aim of this. We want to go back home and help. So when we come home, please open your doors for us. We've come here to learn so much and we can't keep it with us. We want to go back through all sorts of mediums to go and help. So please open your arms wide for us to receive us. A lot of us are coming home to Efian Kwanta, to Kolebu, all over the place to come and help. And if you are back home in Ghana, we used to work there before and we were amazing nurses. So you can't do it if we did it. That's what I will say. But I will say to the family, you know, condolences, because this person lost their life and it's unbelievable that they had to go through that experience. Whatever we do will find us one day, whether it's good or bad. Work hard as if all depends on you, and pray hard as if all depends on God. That's my cue. I'm signing out. Bye. Thank you. Oh, Sister